Hello, my name is Jose Enrique Arauz, and I will talk about Eucaloric very low carbohydrate ketogenic diet in acromegaly treatment. Definition: acromegaly is caused by a growth hormone secreting pituitary tumor, and it seems like to increase growth hormone dependent hepatic insulin like growth factor AGF1 synthesized. The ketogenic diet is a very low carb, high fat diet and involves drastic reducing carbohydrates intake and replace it with fats. This is this reduction in carbs put your body into a metabolic state called ketosis.
Out a pituitary lesion. Acromegaly is the clinical syndrome that occurs when a pituitary tumor secretes excessive amounts of growth hormone in an adult patient. Prior to puberty, patients with growth hormone secreting tumors develop excessive longitudinal growth and gigantism above normal for age. Let's go through some of the external features of acromegaly again. In the head, there may be prominence of the brow and jawline. There may be an enlarged skull. There may be facial edema and coarsening of facial features, excessive spacing between the teeth, usually of the lower jaw, and finally macroglossia, or enlargement of the tongue. The skin can demonstrate thickening and skin tags, and the hands and feet may be disproportionately large. In the joints, arthritis may be a manifestation, and other internal features include diabetes mellitus, hypertension, colon polyps, and excessive perspiration or hyperhidrosis. Obstructive sleep apnea is usually caused by excessive growth of tissue in the upper airway and in and around the mouth, along with macroglossia, which leads to obstructive symptoms when sleeping. Left ventricular hypertrophy can occur in the heart, and these patients may present with cardiomyopathies. And then finally, there are increased rates of cancers, particularly of the colon, esophagus, and stomach, as well as thyroid and even melanomas. A clinical pearl here is in clinical practice, because of the increased number of colonic polyps, patients are predisposed to colon cancers and will often present as a first feature with blood in the stool. The treatment of acromegaly requires transsphenoidal tumor resection, and surgery is the only treatment that is potentially curative. Remission is achieved when IGF-1 levels are within the normal range for age, and the response of growth hormone to glucose tolerance test returns to normal. Patients not achieving remission require injectable somatostatin analogs to inhibit growth hormone secretion. High-dose dopamine agonist therapy is marginally effective when the tumor co-secretes prolactin. Pevisigmont, a growth hormone receptor blocker, is then used to lower IGF-1 levels, but it works in the peripheral tissues as an antagonist to growth hormone and does not decrease growth hormone production by the tumor.
It's official. The low-carb diet craze is over. Hello, New Year.
Okay, omniscient voice on TV, calm down. It seems every couple of years or so, there's a new diet to try. South Beach was popular during the early 2000s, then paleo took over towards the late 2000s. But around April 2017, you can see in this Google trend graph a new diet surpassing it.
Celebrities like Halle Berry and Kourtney Kardashian are going nuts for this diet. Keto devotees claim that if you banish carbs and eat lots of fat, your body will start to actually burn fat and you'll lose weight and even reduce your hunger in the process.
But what's lost in this keto chaos? There's no evidence that keto diets work better than any other diets for most people hoping to slim down. Although keto may be the latest in fad diets, it's had promising results elsewhere. It was used since the 1920s to treat epilepsy. Outcomes from this 2018 study showed its potential in treating subjects with type 2 diabetes. As a diet for weight loss, it's been around for a while. Keto's most recognizable form is from the 60s, the Atkins nutritional approach, pushed by the late Dr. Robert Atkins. R.I.P. homie.
The theory behind this diet, the insulin carbohydrate hypothesis, suggests that people start to burn more calories more quickly and burn off more fat.
But it's still just a hypothesis, and several high-quality studies have debunked these extra fat and calorie-burning claims. So exactly what foods can people eat on keto? People are supposed to get 5% of their calories from carbs, about 15% from protein, and 80% from fat.
That means staying away from things like bread, grains, rice, cereals, chips. You're definitely not going to be eating chips. And eating lots of fish, meat, eggs, don't throw the bacon at me. Bacon, things like this. The goal is to get your body into a state of ketosis. So basically our bodies are fueled primarily by glucose, which we get from carbohydrates. But when you eliminate carbs and you start to eat lots of fat, instead of burning glucose for fuel, your body starts to burn fat.
To get into ketosis, you need to eat less than 50 grams of carbs or 2 slices of bread per day. And of course, eat a lot of fat. Sounds simple, right? Basically eat no carbs and the weight will come right off. Well, actually, there's some evidence in super low-carb diets being effective in appetite control. And low-carb diets like keto can sometimes give people the impression in the short term they've lost fat, when in reality it's rapid water weight loss. Plus, the more extreme a diet, the less likely a person is to stay on track. The average person can't stick with the keto diet for even 6 months. It's especially challenging in a world with temptations of easy, overprocessed, and high-calorie foods at every corner.
When you stack very low-carb diets like Atkins or keto against other types of diets, in the long run, people lose about the same amount of weight as they would on any diet. There are always outliers. There are always people who do really, really well, and it's possible you may be one of those people who really benefits from a ketogenic diet. But on average, they don't work for most people.
There's some hard truths about losing weight and keeping it off. It's really difficult. It takes a long time. And while keto may work wonders for some, like people with diabetes, the best diet overall is probably one you can stick with.
Application in medicine. Eucaloric very low carbohydrate ketogenic diet induce cetosis and reduce portal insulin concentration, with down regulate hepatic growth hormone receptors 2 and reduce IGF-1 synthesis. We hypothesize that in patients with acrogemaly, eucaloric very low carbohydrate ketogenic diet both exert insulin induce IGF-1 normalized with the unplanned increase in growth hormone.
I recall in our last discussion you mentioned the refeeding phase was really important for the stem cell proliferation. So after you activate them, you want them to proliferate and continue to grow. And you had mentioned, if I remember correctly, that IGF-1 played a major role in that proliferation because it is, after all, a growth signal,
Yeah, so there is no doubt. We haven't spent too much time on it, but it's pretty obvious, and that you'll need growth factors to do that. So this also makes us think about, for example, the clinical trial, the multiple clinical trials that were done on IGF-1 in cancer that failed, right? And we thought, well, maybe they failed because the IGF-1 was also needed, for example, for the immune system to be built or rebuilt, and in those trials, right? So then the generation of healthy cells is as important as the low IGF-1. So the generation of healthy cells that is IGF-1 dependent is probably as important as the killing of damaged cells that is low IGF-1 dependent, and the turning on of stem cells, which is also low IGF-1 dependent. So
it's low. I thought it was higher. The turning on the stem cell, not turning on, the proliferation of them is high IGF-1. Correct?
Yeah, no, but the turning on, the initial one is low. Low now is the signal to self-renew. You know.
Yeah.
So now you have a population of a small population of stem cells that are just active and standing by. Then probably when IGF-1 goes back up, now they are the ones that are pushed by IGF-1 to proliferate and to differentiate, probably also to differentiate, proliferate and differentiate. Because now you want to rapidly make
new
a lot of white blood cells, for example, or whatever it is. Yeah.
So that's my question about, my question to you then is for the refeeding phase, then do you think then, for example, having some protein would be a little more important because you want protein being essential amino acids, because you want a little more IGF-1 activated during that specific time window? Is that something that you...
Yeah, there is no doubt that when you refeed, you have to have sufficient protein to rebuild. And if you don't, I mean, you really don't have the bricks to rebuild the whatever system you partially broke down. So yeah, protein, and also protein are going to drive the IGF-1. So the whole system, of course, is set up to the sugar and the protein is set up to give the signals to rebuild, which is probably through IGF-1 insulin and IGF-1.
Pros and cons. Pros: improve insulin sensitivity and resist diabetes, less risk of cardiovascular disease, great fat loss, and less visceral fat, appetite control. Cons: nutrient deficit, short-term fatigue, liver and kidney problems, bad breath, digestive problems.
Ketogenic diet is where ketone bodies are produced by the metabolic breakdown of fat. Therefore, fat is used for energy rather than carbohydrates or proteins. So, in brief, a ketogenic diet has very, very little carbohydrates, moderate amount of proteins, and a lot of fat. By eliminating sugars, carbohydrates, and moderating the proteins, the body goes into ketosis. This will not only encourage weight loss, but it is anti-aging, anti-cancerous, anti-hypertensive, and anti-diabetes. So, patient gain in not only losing weight, but also for their health.
Issue applied in Ecuador. The problem in Ecuador is that there were not studies that prove that there is a real improvement in this diet. About there are studies in another country that have been.
Dr. Hyman, I'm so confused about this low carb, no carb, high carb. I don't get it. What should I be eating? Are carbs bad for you? Are they good for you? What should I eat? Well, I've got something surprising to say to many of my listeners who've been following my work for a long time. Carbohydrates are the single most important thing you can eat for health and weight loss. And you're thinking right now, Dr. Hyman, have you gone nuts? What are you talking about? Carbohydrates? I thought you were always talking about how bad they are and how they cause diabetes and diabesity and insulin resistance and heart disease and make you fat and everything. So why would you be telling us to eat carbs? Why? Because all plant foods are carbohydrates. And when I'm talking about carbs, I'm talking about the good carbs, or what we call slow carbs. These are carbs that don't spike your blood sugar. And these are fruits and vegetables. And nuts, even nuts and seeds contain carbs. These carbs are very low glycemic. They don't spike insulin. They don't spike blood sugar, which is the key here. And you know why they're so important? Because they contain all these amazing molecules called phytochemicals. So for example, broccoli, you could eat like 21 cups of broccoli, and good luck if you can eat it. That's like 750 calories, but the net effect on your body would be not to spike your blood sugar, would not be to actually increase insulin, would actually be to fill your body with fiber and phytochemicals. If you have a lot of potatoes, probably not a good idea, especially the hybridized potatoes. But you know what? The little fingerling potatoes that come from Peru, those purple or red or little non-starchy potatoes, those are actually better for you. They have more phytonutrients. They don't spike your blood sugar as much. So you actually want to eat very original foods. Don't eat processed foods. Think about how far it went from the farm to your fork. If it took a lot of steps of processing, that's not good. But if it's a whole, real, fresh fruits or vegetables, those are all carbs. In fact, we should have 75% at least of our plate being these non-starchy vegetables and some low glycemic fruit like berries. That's okay. And then the rest of it is good quality fats and good quality protein to balance out your diet. But by volume, most of your diet should be carbs. By calories, it won't be, right? Because you could eat 21 cups of broccoli, if good luck, and that's only 700 calories. But the truth is you really get most of your calories from fat and from protein and very few from carbs. That's the key. High glycemic carbs are the bad ones. Pasta, bread, potatoes, rice, processed foods, a lot of grains. Even whole grains sometimes can cause spikes in blood sugar. Now there's some other really cool carbs. One of them is called resistant starch. Now I'm going to talk about this more later on in another blog, but a little preview. Resistant starch is a type of starch that doesn't spike your blood sugar, that improves insulin sensitivity and can even affect diabetes beneficially, and that also acts as a prebiotic to help fertilize all the good bugs. And that's another reason you want a lot of carbs, because they provide fiber. They provide all the nutrients that help fertilize the good bugs in your gut. So remember, you want to eat carbs. You want to eat the right carbs. You want to eat slow carbs that don't spike your blood sugar.
Conclusion. The ability of very low carbohydrate adjuvant eucaloric ketogenic diet to result in IGF-1 control has been demonstrated in patients with acrogemaly dose dishes, was not controlled by first generation somatostatin receptor ligand therapy. Additional studies are needed to assess long-term safety and efficacy, as well as advance to a very low carbohydrate eucaloric ketogenic diet.
Meet GH and IGF-1, growth hormone and insulin-like growth factor 1. Everyone has these two hormones, which are normally under control. However, for those who are living with the rare disease acromegaly, GH and IGF-1 easily can become uncontrolled. Acromegaly is a rare hormonal disorder caused by a non-cancerous tumor on the pituitary gland, which causes GH and IGF-1 to get out of control. Some of the typical symptoms include headaches, enlargement of forehead, jaw, hands and feet, excessive sweating, and high blood glucose levels. It can take years for patients to become aware of their uncontrolled GH and IGF-1 levels. And once diagnosed, patients need to regularly monitor these two hormones to ensure they are on their best behavior.
I had never heard of GH and IGF-1 levels prior to my diagnosis, but now I think about them regularly, hoping they are in check. Fortunately, I was able to work with my doctor to develop a game plan that allows me to keep an eye on my hormones and be sure they stay controlled.
Following diagnosis, patients work with their doctors to develop treatment plans personalized to their individual needs, which may include surgery to remove the pituitary tumor or medication to keep the disease controlled. However, acromegaly can often become uncontrolled. After surgery and/or medical treatment, GH and IGF-1 are reduced but can still find ways to sneak back and impact a patient's life, especially if the tumor was not fully removed or returns.
At first, I had no idea what to look out for when monitoring for signs of recurrence. I knew that frequent urination and thirst are symptoms of diabetes, but I didn't know how to identify the symptoms of uncontrolled hormones in acromegaly.
People living with acromegaly should be on the lookout for key symptoms, such as excessive sweating, headaches, and fatigue, which can be a sign of inadequately controlled disease. Patients experiencing these symptoms should talk to their doctor as soon as they can to get their hormone levels checked and ensure their acromegaly is under control.
There was a time I was sweating so much, I felt like it was really restricting what I was able to do. Just to leave the house, I was bringing an extra shirt with me because I knew I would need to change. I eventually realized, okay, this isn't normal. I need to talk with my doctor.
It's crucial for patients to pay attention to their bodies and have their GH and IGF-1 levels regularly checked to ensure their treatment plan is working effectively. Don't ignore any symptoms, which may indicate that the disease is not properly controlled. You know your body best. If something feels off, make sure you check with your doctor to ensure everything is still on track. For more information and resources for people living with this disease in the U.S., visit www.acromegalyinfo.com.